people coming on in. That's so exciting. I know some more will join as we get started, but just want to welcome everybody to our session. My name is Bailey Johnson, and I'm the Event and Marketing Manager at Impact Hub, Minneapolis, St. Paul. And if you're not familiar with Impact Hub, we are a community for social impact entrepreneurs. We provide a co-working space in Minneapolis. We have a space in Stadium Village, right by the University of Minnesota, and offer trainings, support programs, social events, all for our amazing community of social impact entrepreneurs. And Impact Hub is also a global organization. One of the coolest things about it is that there are over 100 Impact Hubs all over the world, each one a little different based on their social context. But the Sustainable Development Goals are one of the things that links us all together and helps us kind of track and guide the work we're doing to really make the world a better place and build better businesses together as entrepreneurs. So excited about this conversation. So grateful to have our esteemed panelists today. And with that, I will introduce Mark Ritchie. He is the president of Global Minnesota, which is a nonprofit organization that is connecting Minnesota to global issues. So perfect moderator for our panel today. Thank you so much for being here, Mark. Pass it to you.
Thank you, Bailey, and to all your colleagues at Impact Hub. I first heard about Impact Hub in a coffee shop in Helsinki, Finland, and I was so thrilled when this young man said, "Oh, there's one in Minneapolis." I actually think he meant St. Paul, but it's so great for us to be brought together by you, and I know that each year this is part of the work of Impact Hub. So thank you, and to all who put together Twin City Startup Week. What a huge project, what a big success, but also this is a year when extra vitamins and extra love and extra inspiration and extra just beating hearts in the concept of hope are so important. Let's not even go through it. Let's just love it to death today. We're going to have 3 amazing presentations about how the SDGs, the Sustainable Development Goals, are being used to help drive entrepreneurship, specifically in the companies you'll be hearing from. But I just want to say the SDGs, for me, somebody who's maybe been around a while, has been revolutionary, because the Sustainable Development Goals, when they were articulated with specific objectives, they gave all of us a new capacity to say, oh, we want to work on traffic fatalities. We want to work on gender equity. We want to work on racial discrimination. We want to work on eliminating hunger. We now had a global tool that all the leaders, the national leaders, had agreed to. Civil society had helped build those metrics, those goals, those objectives. There was buy-in from the whole planet. And it has become part of our life in the public-private world of saying, you know, we've got goals. We've laid them out there. We're all doing interesting, amazing things. How do we link arms more closely? How do we learn from each other and share best practices and successful practices? And how are we doing? You know, we've had a COVID. It's been a rough period. Some things that we were going gangbusters on have been pushed backwards. But what we have is the experience now of 6 years. There's going to be, 15 years altogether. These goals were picked in 2015. They're going to be set for us as objectives for 2030. So we're now got 9 years left, and we've got some big ambitions, but we have amazing people who are making their daily work, their businesses, their place of employment, focus on helping to achieve those collective global goals. I want to welcome our panel today, and I want to ask each of you to give us a brief introduction, and then we'll jump in on some of these questions. Bailey, you're in my line of sight. Jump in there. You're already introduced. Lori, you're next.
Perfect. Thank you. Thanks for the intro. My name is Lori Most. I'm the founder of Binary Bridge. That's our company. And then our product is Backpack EMR here, like you can see on the back wall. I also was introduced to Impact Hub pretty early on at the start of my startup. And so that was back in 2015, 2016. So really excited to be working with Impact Hub and the rest of those on the panel here. So to give you a really brief overview, so my background is all software development. So I started Binary Bridge in 2016 after seeing an issue when I went on a trip to Peru. So I went with my sister. She's a physician assistant. She was doing orthopedic surgeries pro bono in Peru, and they were using paper for all their clinics and all of their documentation. Perfectly fine to use paper. It's a great solution in a lot of scenarios, but unfortunately they didn't have access to past medical histories, and they weren't able to really share information amongst all the different groups. And so what we found was they needed an electronic medical record, similar to what we have in the United States, but just a little more simplistic. And then the biggest challenge was there's no electricity or the internet necessarily in a lot of these clinics. And so that was a challenge. And I accepted it. And we found a way to do an offline peer-to-peer syncing network. So that's what is key about Backpack EMR. We've sort of migrated over more into primary care, where really some of the bigger need is, so that other teams like Doctors Without Borders, some of these other groups who do mobile clinics could use our system to track patients. And then we've also moved since COVID into more virtual care. And again, we can't necessarily use just video chat like you can here in the States, since there isn't necessarily internet. So we do asynchronous virtual care, where you can collect data offline safely and then send it up to the cloud, or then at that point, a doctor anywhere could log in, review that patient chart and give feedback. So that's sort of where we're focused right now. And so with that, I will, can I just popcorn it over to Max?
Great. Thank you, Lori, for sharing that background. Mark for introducing us, and Bailey for helping to bring us all together as well. My name is Max Bach-Aronson. I'm the founder and CEO of Breathe 99. And our goal since the beginning has been to create a sustainable alternative to the N95. And this is actually a business that I started working on, and a product that I started designing before the pandemic, which I know sounds a little bit crazy, but it was born out of my experience living and studying in Southeast Asia. And it was the first time I had lived in an environment where I had to really consider that breathing clean air is a privilege. And because I was in that environment, I was exposed to air pollution that made me think about what protection I might need on a daily basis. And at the time in 2013, there weren't good options for, high efficiency particulate protection against smog, vehicle emissions, things like that. And so I became very interested in both public health and also respiratory protection, because air pollution is this really big, pervasive problem around the world that unfortunately shortens our lives and results in a lot of premature deaths. So I started that journey a number of years ago, and last year we brought our first product to market, which is the B2 mask. And we were able to get our product out to, thousands of people around the world across a number of countries. And we were even named one of Time Magazine's best inventions of 2020. And all of that really is with this idea that more sustainable protective options are going to be the future of public health moving forward. And so we're really excited to be a part of this panel and to share our passion as it relates to the sustainable development goals. So with that, I'll send it on over to Duza.
Great. Thank you so much.
Thanks, Max. And thank you, Mark, for the wonderful introduction, and Bailey for bringing us together through Impact Hub. Lori, good to see you again. I'm Duza Baba. I'm currently working on COVID-19 response, wearing one of my caps as an epidemiologist, working with the United Health Group. And I've been doing that since March. And prior to that, Impact Hub was my was my office, was my go-to place. Again, what attracted me to Impact Hub was the fact that I saw SDG banner in that conference room. I've gone to WeWork. I mean, I've gone to so many shared spaces, and on seeing just the SDGs, the fact that they had that up there made me immediately want to sign up, and I signed up as a member. It's really an amazing thing to come. I've worked mainly in West Africa. I've done some work in Afghanistan in the health sector, SDG 3, water sanitation, SDG 6, and zero hunger agriculture, SDG 2. So it was just great to come in Minneapolis. I think this was the, I want to say, I'm not sure if it's the St. Paul office. So yeah, so let me clear that up. In the Twin Cities, just to be to come to a spot and just feel that global presence. Again, the SDGs are global, but they are implemented locally. And in the work that I'm doing, I'm getting involved here in the Twin Cities, looking at the healthcare crisis linked to chronic kidney disease, and working upstream to look at diabetes and high blood pressure, and then looking at disparities of health. And in that kind of work, we'll talk a little bit about partnerships, but you got to work with the state, the federal government, with the communities, the private sector, whether it's insurers or the providers as well, and some nonprofits. So I'm excited to contribute to this discussion.
Thank you so much, and incredible work that you're all doing. We could spend days on all of them, but today we're lifting up the SDGs so our audience can see how this could be helpful to them, whether they're dreaming of a startup or in that terrible crunch of happening, or they're trying to scale up. I want to ask each of you, the 17 of these SDGs, which ones do you think are really something that a business starter, an entrepreneur, or just somebody who's thinking about it might want to grab a hold to? Lori, let me start with you. What do you think is another one of those SDGs that somebody could really sink their teeth in and get some energy for their work and for their new company?
I think all of them are important. So I would back any of them. Some that we've seen. So we are obviously all about SDG 3, which is health and wellness. But we definitely partner a lot with hunger. So the zero hunger along with gender inequalities. And so those are two that are really big right now. Obviously, they always have been, I guess, really, but especially the gender. So with COVID, just like we saw here in the US, a lot of the women ended up staying home. So from a childcare perspective, school, staying home with the kids, kind of fell to kind of the women. And so that is what happened in a lot of other countries as well. And so if you look at it, I think I was reading an article in Africa specifically, I think they were talking in Kenya, 92% of the women who work are in sort of this informal economy. And so they don't have benefits. They don't have a parachute. So if they're not going to work, they're not getting paid. And so for those women who then end up having to be the childcare provider, they are really the ones who stay home with anyone who's sick. There's really nothing for them. So gender equality is a really big one. That's another one that a lot of our partners work on as well. So when you think of groups like Doctors Without Borders or Samaritan's Purse, or all these other groups who do a lot of these humanitarian sort of health efforts and medical outreach, they're consistently looking at those two lenses as well. And so for that reason, we partnered with population survey tools as well, so that a lot of these teams can start doing surveys ahead of time to see, are they drinking filtered water? What sort of food consumption do they currently have? Where is their biggest need? And then there's a lot of questions around gender equality as well. So from a gender perspective, is the woman, working? Are you staying at home? Those sort of things, so that those organizations who are helping with healthcare can also help with those other two SDGs as well. And so that is a really big focus of a lot of these groups, and our focus as well. So as a digital tool in global health, we feel like we have an obligation to help with those as well, which is why we're trying to partner with other tools that can help shine a light on that. And it's not only just understanding the problem, but helping as well. So education is a huge part of that. So a lot of our teams do education not only on women's health issues. So a lot of the cervical and breast cancer screenings are happening a lot now, along with education on that, but also sex education. I was a part of a team who was in Haiti. This was a couple of years ago, and there was a sort of a community ed talk on some of the sex ed, and so protection, multiple partners, the STDs. There was a woman in the audience who was listening to this, and she just perked up as she was listening. She ran out and grabbed her partner, kind of dragged him in so that he could be part of the conversation as well. So starting with those women, educating those women so they can protect themselves, and then educate others as well. So that's also a big part. So if you're starting a startup, looking to help with SDGs, those are our two big ones, as well as health, of course.
Lori, I love how you told your story in the beginning of just finding yourself in another part of the planet and seeing a problem or seeing an opportunity, and then how it's grown and it's really become now connected. It's kind of fundamentally, one of the main SDG 3s is universal healthcare. I mean, there's a lot of specifics, maternal health, but universal healthcare, and you are helping make it happen. Max, you also started a story with being someplace and saying, hey, breathing fresh air is ought to be a human right, is not available to people. Tell us what are those kind of connection points that you've seen that you think would be, for others who are watching us today, places they could think about how the SDGs could help them start and grow their business and give them a North Star for those rough days.
Yeah, well, I think to Lori's point, all of the SDGs obviously are really important, and they're interwoven as well. There's a lot of we talk about intersectionality in terms of how some of these development challenges affect people differently depending on who they are and where they live and things like that. But the goals themselves are also very interwoven as well. And so I think for young entrepreneurs who are interested in starting a business, the SDGs can be a really valuable framework where it helps you maybe identify what some of the things you're most passionate, so what problems you're most passionate about solving, because that passion is really going to create some buoyancy and help create that ballast when you face difficult times. So for me, when I was in Singapore, to your point, I mean, I was studying engineering, but I was always interested in health equity, and I kind of knew that. And so when I identified that breathing clean air was this global health challenge, for me, that I was able to connect the SDGs to my own personal interests and personal lived experiences. And it was only through my journey of learning how to procure raw materials and how to manufacture goods and how to bring a physical product to market that I started to become more interested in some of the other SDGs, primarily SDG 12, which is responsible consumption and production. And then SDG 13, which affects us all, which is climate action. And so I think you maybe the advice would be pick something that you're most passionate about, and you will find the interconnections with the other SDGs as you go.
Great advice. Duza, these have been great, important connection points for you, but you're also very professionally trained. But I know what that means when you saw that SDG, saw that there at Impact Hub, you go, oh, they're in my tribe. Wait a minute, that's the whole planet. Okay, how do you see this coming together? You already started talking partnerships. I bet that's one of them for you.
Absolutely. So, I mean, as a startup, think about it, right? You have, whether it's a product or service that you have, you really need to do what we call a stakeholder mapping. I mean, who are your stakeholders? your customers, suppliers, providers, the ecosystem, that over there, that's partnerships. Those are partners. You could think of those various groups as partners in getting your business traction and getting it off the ground. And in my day-to-day, the partnerships are key. The other hat I have is as an economist, and you always say economists talk about limited resources, So when you have limited resources, how do you maximize, your outcomes with the limited resources you have? Well, you have to leverage partners and partnerships. I bet you Lori has partners that she can talk about, as does Max, and as do you, as you start up with your ideas. But for me, again, I'll just bring this back home to Minnesota, the Twin Cities, and this is learning about things that I've done outside the U.S. So bringing some of that global perspective, but back at the end of the day, as I mentioned earlier, all implementation is local. So it doesn't matter where you are, it's all local. And then, we form this global body, right? So I'm learning about the health sector here in Minnesota, particularly, as I mentioned, looking at chronic kidney failure and upstream to the conditions that lead to that. In the US, the federal government pays for treatment for people that have chronic kidney disease. I mean, because no one can actually, very few people can afford to pay the amount of money year in, year out, hundreds of thousands of dollars in some circumstances, annually. How many people can pay that amount for care to survive and to live a good quality life? Not a whole lot of people. So the federal government, through Medicare, Medicaid, cover that. But prior to getting chronic kidney disease, who covers you? Who covers your healthcare? Well, some people have private healthcare at that point. So, the private sector, whether it's through the employer, through their jobs, or through, family, again, mainly in the States, it will be through your job. And then, so you can see that on one side of the ledger, you're being covered by the private sector. But at the end of the day, if you progress to chronic kidney disease, the government, hence the taxpayer, so we collectively are paying for that healthcare. So how do you, work with both, again, the private sector and the government, and how do you balance, those interest, right? But the whole idea being keeping the individual healthy. This is going to take a lot of coordination between the government policymakers, the private sector, but also the individual as a partner. What can they do to continue to maintain a healthy lifestyle? So it's not just the insurer, the government, the individual really is the player, is the key here. How do you engage with that individual and provide them the support so that they can continue to live a healthy lifestyle? So I am working, working with the Department of Health, learning about the sector. They're currently working on a 10-year plan for diabetes and heart disease in Minnesota. So I'm engaged in that process and linking in that. I'll be learning. I'm still learning quite a bit, but trying to again extend, particularly to the groups that are marginalized, and trying to see how we can empower them to actually now take more action on their health, so that overall the state is healthier. We have a booming economy, and our costs, healthcare costs, can be reduced.
Oh, Mark, you're muted.
Sorry, dudes, I was loving the way you were connecting the word partnership with the individual and the whole society, and then the partnership between the different SDGs. Because sometimes we think of partnerships as sort of, this big group and that big group getting together and working out some kind of an arrangement. But you were putting it into the personal terms. And I just love that, because one of the things about the SDGs is sometimes, and I know all of you probably have heard this plenty, but people say, oh, it'll cost trillions of dollars. And I just say, wait a minute, SDG 3.6, reducing road fatalities by half and injuries by half. You will save money if you stop killing people on the roads and injuring them on the roads, especially rural people who can't get themselves down to HCMC, get that fabulous care. And so you can take the notion of partnership and the notion of how we're connected together, COVID having reminded us how big that is, and say, really the SDGs are about not wasting our money on destroying the environment, spending our money on making ourselves smarter, stronger, and making our societies more equitable. I know that there are also issues. Max was bringing up the climate discussion the past month. There's just been report after report after report. I mean, it's like a screaming amount of information, but it will take some money to make transitions. But once you have an electric car and you're not having a gas guzzler, you never go to the repair shop and you never go to the gas station. So part of this SDG conversation is to say, yeah, some things we're going to have to spend money. We need schools, we need education, we need the things of life. But it also is about saving money on things that are wasteful, and it's about making investments in a future that's guided by those SDGs, by those goals. Can the three of you reflect on moments in your startup on that beginning part where you really thought, oh, I need to keep my eye on this SDG North Star to help me keep moving ahead? Maybe a challenge or something that happened. Anything come to mind?
I can go first. Given that one of my primary interests in bringing a more sustainable high protection mask to the market was related to reducing the waste of disposable masks. When we were identifying supply chain partners, it's typical for American companies to produce outside of the US. It helps reduce costs significantly, depending on what type of products you're creating, of course. But you have much less control over the quality of your products. And also there's all sorts of inefficiencies associated with producing internationally and then shipping all of your product locally. And so as I was thinking about, responsible consumption and how that and the interplay of doing that with climate action, it was important to me that I wanted to produce locally. And the beginning of the pandemic had this it was very challenging because it was uncertain how we were going to get raw materials and things like that. Global supply chains were starting to shut down. But because I had that sort of guiding principle that I wanted to produce locally in order to not only reduce our carbon footprint, but give us more control over our processes, it made it much, much easier to identify which partners would be best for us. And so I didn't need to conduct this really broad sort of supplier search in order to find people in China or find people in Southeast Asia in order to supply our product. So it helped not only to have that guiding North Star, but also oddly enough, the pandemic sort of created this external forcing function where all of those options, even if we wanted to explore them, were sort of off the table. And so it really highlighted how beneficial and how efficient it can be to produce locally. So that was, there were all sorts of challenges. yeah, there are all sorts of challenges associated with producing locally too, but we felt much more in control of that process. So I would certainly recommend producing locally for people who are looking to build supply chains that are more sustainable and have that be a core part of their business.
Great example. Great example. Lori Duza?
Sure, I can definitely go next. This is a tough one because as an entrepreneur, you're pulled in so many different directions and there's so many different priorities. And I think for me lately, it's been tough because fundraising has been a really big priority. And in doing that, you're talking to a lot of investors and trying to get different groups on board. And for me, from an SDG perspective, and just a mission, it just helped me to just reorient that we're doing this for health equity. We're looking at this SDG3. We're really trying to help, and that really helps orient what we're going to focus on, what we're not focusing on. So, for example, I almost always in every pitch to an investor get asked if we're going to start working in the United States and start focusing on the US market, where all the money is, and where you have all these big funders and payers. And I have to say, no, we're not doing that. We are really focused on health equity. And I feel like the biggest opportunity to help is not here in the US. And not to say that there's not lots of opportunity here too, but that's just not where we're going to focus. So for me, looking at that North Star and for other entrepreneurs out there kind of struggling, there's so many different things pulling on you, remembering your mission. And in so many cases, it is one of these SDGs that's really kind of your North Star, to your point, Mark, about what are you really trying to do with your startup. So that would be my story of, just
now, Lori, did you develop an intuition about don't waste your time on that kind of potential funder because they're not going to be interested in your answer, but hey, that investor might love that answer of yours. Do you kind of cut to the chase, kind of a nose now?
Yeah, absolutely. I've definitely reoriented my focus multiple times because I'll gear towards one way, looking at the investors who I know care about our mission as well. I'm like, oh, but the big money is over there. So then I'll kind of oh, okay, that's right. So yeah, constant readjusting.
Okay, so that seems like a bit of a tip that you have to constantly be readjusting because you're going to get pulled in different ways. And it's not just the wins. It's also real things like money. Yeah, yes. Cool. Duza.
Yeah, that's a great question, Mark. So as you mentioned, the SDGs seems like is this high level thing that is, it's going to cost trillions, gazillions of dollars.
Yeah, that's more like it. Yeah. Yeah.
But truly, again, I keep coming back to, implementation happens locally. Looking at it as a framework, I don't know all the indicators of the SDGs. I just know a few. You mentioned one about the road traffic deaths. Was that 3.6?
3.6 deaths and injuries, half by 2030. Yeah.
Exactly. So, so that is, one of the good things to do is look at those indicators. I'm a data guy. I'm working with some nonprofits to help them actually plan and measure their impact linked to the SDGs. And we're helping them do it at a local level. They work in 10 different countries. So, and sometimes they don't even work in a whole country. They just work in a sub-region. But what it helps them do is, again, looking at the indicators and tracking their contribution to that indicator, and then using that to engage with the local government at the local level and partners to say, now, what are you doing as a, government, holding them accountable or leveraging more resources? Because, each of us working in our own, little worlds in our, whether it's a business or organization, we might not think that we're contributing anything to the SDGs because again, we're not tracking it. But if we can track and just, however small it is, you aggregate all these small players and small actions, and all these small changes or numbers can eventually add up. As the adage goes, you eat an elephant a bite at a time. I'm not advocating for eating elephants here, but those that do, take it a bite at a time. So so that's sort of how I keep myself grounded. Is don't think about it as that big goal. All right, let's look locally. What are the numbers in Minnesota or in Minneapolis, and what can we do to improve it? Increase maybe public transport. Pre-COVID, I'm a big fan of public transportation. I would bus everywhere. I mean, I would plan my routes to go to St. Paul, from uptown. I would bus everywhere because I'm a big fan of transportation. But with COVID, that has changed. Some of our
Right.
interactions have changed. So everyone now wants to get a car. So that's going to impact, and this is how they're all linked. That, me getting a car now means I'm having emissions unless it's an electric car, and then that adds to the pollution. So all these things are sort of intertwined. And so just think about it at a local level, at the smallest level, that you can really have impact. Measure and engage partners, government, other folks working in the area, and see how you can aggregate what you're doing and eventually come up with some sort of aggregate change that will move the needle.
These are three really great examples of like the real world of trying to run a business or trying to deal with a problem. I know one of the things that's going on at the macro level is that, this happens to be the week that the United Nations has in their General Assembly. This happens to be the SDG week because it was first signed at the General Assembly of the United Nations. But it also, today, they use the word pause because today is a day of a lot of workshops and thinking. So pause is an interesting word. Some have called the COVID the great pause, and I kind of think of it as the great thinking. But as a practical matter, we're all pointing out that viruses have their own way. The way that money flows is not something we're in control of. How one issue like a COVID pandemic can affect transportation, which then affects electricity or it affects gas. So all of these things are part of the human condition. I'm kind of wondering, and I want to urge anyone watching to jump into the chat with your specific questions. But I want to ask you, what are some of the places that you go when you're looking for that sort of solution, or that maybe not a solution, but let's say a mind jiggle, when you're trying to figure out a kind of sustainable development, resilient, equitable solution, and you got kind of a core problem. You have a go-to book, a person, a poet, a website, a song, the thing that helps you get over, and then, oh yeah, that solution was, was in front of me, but I just couldn't see it. You know what I'm saying? Bob Dylan, Beyonce, come on.
I'm definitely still thinking too, but one thing that comes to mind, I talk to our partner organizations quite a bit as far as, and there are a few go-tos that I know are very, very open and, are connected locally. So we've got 24 organizations using our product right now in about 22 different countries. And so they have a lot of experience, just so much experience. A lot of these organizations have been running for 50 years or more. And so they really know that local community, and they are really tight with those, all the different communities that we're working in. And so when I have some crazy ideas, I'm like, oh, this is going to be the answer. This is going to revolutionize what all of these groups can do. I typically try to call those groups and just talk through it.
You're using number 17. You're using partnerships.
That's right, for sure.
Bless you. So that's working for you. That's a great example. Max.
Yeah, one thing I was going to mention as a younger entrepreneur who is relatively green, I haven't started a business before. This is my first foray into entrepreneurship, is just having mentors that you can turn to, and being able to say, like, I don't know the answer to this, and reaching and feeling comfortable to reach out to those people in your life, and fostering those connections, and they're really valuable. So don't neglect them. And we all, I think, especially during COVID, maybe weren't on our communication game as often as we might like, but because there's so much going on. But those are really valuable connections to foster, especially if you haven't started a business before. And then a book that I am only 50 pages into, so I haven't finished the book yet. I haven't maybe even been able to deploy some of its wisdom yet, but I can already tell, is called Emergent Strategies by Adrienne Marie Brown. And that's one I'm reading a section right now on the concept of fractals, which are repeating geometric patterns that, no matter how much you zoom in or zoom out, they're similar in structure. And it reminds me a lot of what Duza is talking about, with how the most very often the most deep, impactful actions take place at local levels, and that change at that level, don't shy away from change at that level, because you might be surprised at how that even if the implementation of that initially isn't scalable, you might be creating frameworks for yourself or for other people too, to implement and figure out how to scale. So I think I've had the tendency to, like, maybe shy away, where it's like, oh, I don't know how that would ever scale, for example, and like maybe not even like explore a possible solution. And this book is helping me reframe my thinking about how to problem solve in that way. And it's okay to explore those things, even if you think that might not be something that can be applicable at a larger scale, or economically for that matter. So
great suggestions. Duza.
Yeah. For me, I guess mentorship has been mentioned. I found some good mentors and just people at Impact Hub to chat with. Even if you don't think you have much in common, you might be working on totally different things, but you just don't know where someone will be able to link you up with someone that can help you with the issue you have. So that's one resource. I go pre-COVID. I would go to Twin City Startup Week. I'm wearing the T-shirt from 2019. I go to sessions that, yeah, I've worked in agriculture, so I do the something north. I've forgotten what that. The ag tech. I've done the insurer tech. I've done the retail. I've done the health. It's so interesting that in a insurer tech startup demo day, I saw a solution that would work perfectly for healthcare data. Data, the HIPAA. Healthcare data. What's the term I'm looking for? Lori, help me out here.
The medical records.
Yes, but yeah, in terms of keeping the confidentiality of data, etc. Yeah, so a solution in the insurance industry applicable to healthcare. So so go broadly, don't limit yourself to just the sector that you're working in. And then the last piece I would say is literature. I sometimes when you're reflecting, especially when you're thinking of the next move, I was challenged by a quote I saw in my friend's 9-year-old's bedroom. It's from William Shakespeare. All the world's a stage, and all men and women are merely players, basically. So what do you want to accomplish, in the time that you have, right? And that just, it just helped ground me back to, to take a look back from the busyness and just really refocus my attention to things that I want to accomplish while I'm here on Earth. So, yeah.
Yeah, I tell you, it seems like the human animal has had thousands and thousands of years of startup anxiety and threat of lack of a supply chain, or all these things, done in a different manner, of course, but they're humans, and nature is nature, and the intersection of it is the thing that we want to figure out how to minimize the negative consequences of what we're doing while we're thinking about taking care of each other. And pandemic has made us think about how to being prepared for what nature can and does do. So there's an aspect of the SDGs that, the Sustainable Development Goals. And now I've occasionally seen people do the little carrot input and resilient. Resilience is a relative, but it has some special elements that probably the COVID has forced us to consider. You mentioned supply chain issues, Max, and how having made an earlier decision that you could better control things like waste and greenhouse gas emissions by being closer in, but then they had some other benefits. I wonder if the word resilience has entered your thinking, your language, your activities in special ways in this last period. And that other word, equity, has it entered in new ways, in reinforced ways, or in conceptually different ways that adds to making the Sustainable Development Goals even more well-rounded, more inclusive, more comprehensive?
It's a great question. I don't know that I have necessarily thought of resilience as as sort of an extension of the development goals, but I think that makes perfect sense. And so as I reflect on it in real time right now, I know that as it relates, you brought up our supply chain. We were at the beginning of the pandemic, we weren't in production at the time. But we were thinking about how a better reusable mask would be really important for public health and public resilience as well. This is not a product that I was designing with a global pandemic in mind. I was thinking about it in terms of better pollution protection that would be sustainable. And pollution is inherently an episodic sort of external event within our environments, which is to say that it's good some days, it's worse other days, it depends where you live. And so when we were developing the product, we weren't thinking about the need to wear the mask every single day. We were thinking about this more in terms of like a first aid kit for your lungs. It's something that you would have in your drawer, hanging on your coat hook or something like that you would use when you needed it, which speaks to resilience, right? It's the ability to adapt to the environment around you, be it the physical environment or the emotional environment, and be able to weather those eventual fluctuations. And so I think that our product at its core was always like that, and that from that sort of extended our thinking about how we wanted our supply. Once we started going into production, it was like, okay, what does resilience look like when it's embodied in our supply chain? If you look at our values as a company, you'll see the word resilience woven into those values. And as it relates to our culture, I think one thing I sort of founded Breathe 99 along with 5 or 6 other people. We sort of built it together over the course of the pandemic. And I think what we experienced collectively together was just how difficult this time is emotionally and spiritually. And so we did our best to be as sort of kind and soft and tender with one another during that time. And so I think that it's not just the physical manifestations of resilience that are important as they relate to how our businesses are operated, how we procure raw materials, how we produce them into goods, and how we ship them to the people who really need them. But it's also about how we're taking care of each other and ourselves and how we are in community. And I think that I just keep coming back to this idea of local versus global, because I think if we're strong in that regard, if we're resilient in our homes, that sort of emanates outward from there. So I don't know if that necessarily answered your question, but it's what came to mind.
Oh, well, I mean, resilience about ourselves, our loved ones, our partners, our friends, our ideas, and the way that love and tenderness and kindness. There's a very famous big medical system in our region, and its original theme was a place of organized kindness. So I feel like this is in our DNA here. So thank you for sharing that. Lori and Duza, we're getting near the end. What are your thoughts about that resilience and that equity, winter woven plaid?
Sure, I can throw in something and kind of be quick and pass it on. But from equity specifically, it's a little bit loaded. For me, just in building this company and Backpack EMR, we really, initially when we started, we really sought to help out these humanitarian teams who were going overseas to provide medical clinics. And the idea of equity is a constant in the back of my mind. Equity. And I started to see a little bit more of a shift, kind of to the point like we were all talking about, more of the local empowerment, even to the point of patient empowerment. Patients should know about their data. They should have their data. The local healthcare teams, that could be community health workers or health organizers, should really be the ones driving a lot of that healthcare. And so over time, our mantra has sort of changed from just this tool to be used by maybe US-based or European-based teams going overseas and providing clinics, more to this is a tool to help empower local teams to take control of their healthcare and maybe get some help on oversight and feedback from overseas medical professionals where there might be a lack of professionals maybe today. But over time, really building in that equity, it's just such a strong pull for me right now. And over time here, it's kind of growing as I go, right? But also looking at then connected devices and AI capabilities and really just that local empowerment. What can we do as a tool to help, where we're not the ones bringing the healthcare? We're not the ones coming in with a solution. We're just a tool to help,
That's a fabulous example. And, that little mantra, self-care is the new primary care. I mean, right. You're there to see, but it's great to hear about that evolution. Yeah. Duza.
Yeah, so those two questions, pretty loaded. Resilience.
Amen.
And equity. Yeah. So what I'll say, and this I'll bring it back into the pandemic, is basically we're only as strong as our weakest link. We do live in a global village. This is what COVID has reminded us. We may have forgotten that we live in a global village. And COVID has reminded us of that. And, we are only as strong as our weakest link. And this boils down to equity. If you're thinking of, let's say, the distribution of vaccines, for example, I mean, as long as there is there are hosts, human hosts that are not vaccinated, the virus will continue to mutate. And I mean, in nature, oftentimes you will get, more lethal and more infectious viruses. That is just generally how these things go about. So it's really, important to get as much as we can out to everyone. Again, this is where the U.S. is leading, and and it's not been easy, clearly, at all. But that is what is going to help us get through, this pandemic. And yeah, speaking about resiliency again, it's the system. I mean, I think locally here in the States, and we still are in a situation where the healthcare system in some states is overwhelmed, and it's making people think about, okay, what system do we have currently in place, and how can we adapt, so if there's ever something like this again, we can respond better. In the early days, states sent healthcare workers, to New York, to the states that had the big surge. But when everyone is having it at the same time, you can't send healthcare workers, to other places. So that is making people rethink, the systems that we have in place. So it will really impact. I mean, there will be a lot of systems thinking, like you mentioned, the pause. This pause is important, locally in the States, how we set up healthcare globally, and global collaboration in terms of infectious disease, international health regulations, enforceability of, countries reporting these earlier, so that we can get ahead of it by a couple of days. Even a couple of days can mean the difference. So, lots of time to pause and think, how can we do better?
How can we build back better? Thank you. Thank you. Thank you.